We ready, Carpo? Yep. Good afternoon, everybody. I stand here with a heavy heart today as, unfortunately, we sent a release out a short period of time ago, and we've had our first death in our community related to the COVID-19 disease. Our prayers go out to their family members and all of the friends of the deceased. We never wanted to deliver this news, but we knew this could be part of this process. And certainly, if you reflect on how quickly this can move and how real this is, just 8 days ago, we had our first case in the community, and here we are. Saying that, the number of total cases is 60 cases. That's up from yesterday. 8 of these individuals are in the hospital. 3 are in critical condition. Out of the 60 cases, we have 53 individual cases with 7 contacts via quarantine. And through our health department's investigation, we have determined that 8 of these cases are linked together outside of a familial relationship. So when we talk about community spread, and we talk about social distancing, there are 8 separate cases that we have now been able to connect the dots to these people engaging and interacting in a social way. 29 of these cases are female and 31 are male. We have 3 cases under 19 at the ages of 16, 18, and 19. I specifically will only go into those ages there because it's important. These are not young children. 13 in their 20s, 7 in their 30s, 9 in their 40s, 11 in their 50s, 7 in their 60s, 9 in their 70s, and 1 individual is in their 80s. 206 people are currently in mandatory isolation and quarantine. This is a moving target. At some point, people will be coming off. Right now, as we get new positives, new people are coming on. 27% of individuals are under 30. 38% are under 40. 53% are under 50. 72% are under 60. And 28% are over 60. A geographic breakdown: City of Syracuse, 18. Town of Salina, 8. Town of Clay, 8. Town of Cicero, 5. Town of Onondaga, 4. Town of Camillus, 4. Town of Manlius, 3. Town of Skaneateles, 3. Town of Lysander, 2. Town of Pompey, 3. Town of Geddes, 1. And Town of Lafayette, 1. What does this all mean? We knew as we did robust testing that we would get more positives. Our goal is to identify people who are sick with respiratory illness. By doing that, we then have to rule out COVID-19. When we identify positive cases, our health department acts very swiftly and identifies through their investigations individuals that should be in quarantine. We realize that robust testing comes with a gap in the test results. We know on average, and this holds true, on average, the turn times right now in the marketplace are 3 to 5 days. It's been reported that we have some cases in day 6 and maybe going into day 7. That is true. That is accurate reporting. It is also accurate to say that over the last 24 hours, people who have been going to the Syracuse Health Center have been receiving turn times in 24 hours. So on average, this is where we are. We have some where it's very quick. We have some where it's prolonged. Those are specific cases from last Monday through Wednesday at the health center's testing triage site. That backlog is now starting to come through, and that process is starting to come through. So hopefully all those individuals will be receiving their test results either today or tomorrow. Again, a reminder, you only get a test if you're symptomatic and you're sick. So these individuals are under a mandatory quarantine until they get their test results back. We realize that for those of you who got tested last week, in the beginning part of the week, this is an inconvenience, but it's a necessary inconvenience, and we ask that of you and we sympathize with you that you don't have the results back. I'm sorry about that. But the marketplace, we don't control the marketplace. We don't control the demands of these labs. The rules of the labs have changed. They now, their regulations are now a little bit more lenient, so they can do different things in different ways now. That's why you're seeing the faster turn times. Certainly at the Syracuse Community Health Center triage site, we've had over 1,200 referrals since it began. If you look at the chart, I think the chart's over here, the triage chart, I think you'll see that there continues to be a downward trend in testing referrals. We've seen that not just at the triage testing site, at the other hospitals. That data has been reported as well. So our hope is that the demand for testing is less because the people who are sick, we're getting to them, and that we're getting in, stay in front of this. Yesterday, we talked about Ashoti's meat market, formerly in the village of Salve. Somebody called my office correctly, and it is now in the town of Camillus, right over the borderline on Milton Ave. Again, we gave information where we needed to know if you shopped at Ashoti's from 12:30 to 4 p.m. on Tuesday, March 17th, St. Patrick's Day, please contact your physician for guidance. That does not mean that you had contact with someone who was working there who was positive. That means you should call your doctor. You should review your symptoms if you have any with your doctor. Today, a similar press release went out concerning Bethany Baptist Church at 149 Beatty Street in Syracuse. A person who attended services on Sunday, March 15th, 2020, has tested positive for COVID-19. Members of the public who were in church that day may have been exposed. That doesn't mean you were exposed. All close contacts of the individual have been notified by our health department, but we are asking for help into this investigation. If you went to church that day, certainly if you have a fever, a cough, or difficulty breathing, we ask that you put yourself in a quarantine immediately and contact your doctor. Certainly, yesterday we were working on investigations. A number of cases have come up. We had questions related to how many people are in the health department currently working on investigations. We currently have 41 people devoted to this effort at this time. We have over 300 volunteers in the medical community that have the ability to help complement the efforts from our health department, who is doing a fantastic job. We also have sheriff investigators. We have assistant district attorneys that if we get an event where we need help, I will talk to the DA, I will talk to the sheriff about reassigning some of that personnel if need be. We are ready for this. We are going to see a lot more results coming in. We still have a slew of tests that will be coming in. We anticipate that the data will hold, that we'll see between 4 and 5% of these testing results continue to be positive cases. Just a reminder, everyone, once our health department is notified of a positive case, they begin surveillance and investigation immediately. It is only when there's gaps in their investigation that we have to notify the community at large with possible exposure, just like we did with Bethany Baptist. There will continue to be reports when employers put out to their workforce that there was a positive case. If you are not receiving a press release from us, we have done our investigation, we are comfortable with our investigation, and we are comfortable with who is in quarantine, and most likely we helped those employers put together those reports that you see out. I know there was questions about employers that positive cases at different schools today. We are comfortable with the investigation, and we are comfortable that those who had close contact with these individuals are now in quarantine. We have over 1,333 test results back, 60 positive, 4.5% is the number. Again, this number of results, our information is showing that we're probably getting a lot of new results back in within the next 24 hours as that initial surge at the triage site from Monday through Wednesday is starting to become reporting back at this time. Certainly, I want to dispel some rumors and give some cautionary advice. We have received many tips. If someone is tested positive for this, you will hear from your doctor and the health department. You will not hear from anybody else. Okay, so your doctor may contact you if you test positive, or Dr. Gupta and her team will call you. No one else is going to call you. If they are not legit, and it is a scam. Some other rumors I'd like to dispel for the community. There is no transportation curfew at 8 p.m. If you are an essential employee, Uber and Lyft are still operating. As part of that, all Central rides are free starting today. So we've gotten calls about a transportation curfew. There is none. In my emails, I'm also receiving certain news related to other scams, calling our residents, particularly preying on our seniors, which is disgusting, offering services and products that might help them through this crisis. Everyone should be wary of these solicitations. Our investigators nor anyone will ever be asking you for your Social Security number. If that happens, please contact our office or the District Attorney's office right away. It is really unfortunate that those are preying on our vulnerable at this time. The Upstate Triage line, we've had over 6,300 calls for assistance. This is key in flattening the curve. It's been key in really boosting up our medical infrastructure. We've had over 27,000 people go to the Upstate Microsoft Coronavirus Assessment Tool. That is at upstate.edu on the main page. That is an algorithm with our friends at Microsoft who are helping us and helping everybody in the community utilize that algorithm to talk about their own health. Certainly today is a tough day as we've lost one of our neighbors. And to many of us, these people are not strangers. This is the human side of this. We need to reduce the stigma of people who have this disease because they've done nothing wrong. And I know that everybody knows that, but this is a day that is a sad day because of this. But it also should be a wake-up call related to social distancing for our young people specifically, and for parents. This is real. We have people who are getting this. If you get this and you have pre-existing conditions, you're going to have a hard time. So you need to take care of yourself. That's why we have seniors staying home. That's why we have people in non-essential businesses staying home. That's why we're asking parents each day, as hard as it is, to keep your kids at home with you where they're safe. And we're asking parents, if you're having a hard time with all of this, to contact 211 and talk to somebody, talk through these things. We know this is difficult. Certainly, our senior first responder and adult nutrition line is there. It's 315-218-1987. We've had over 1,400 nutrition requests. In addition to that, the rescue mission is serving as a grab-and-go site for anyone in the community needing nutrition. They are to-go meals there at 7 a.m., 11 a.m., and 4 p.m. every day. Daycare right now for our emergency workers, our healthcare workers, and our essential businesses. If you run into daycare challenges, daycare is free of charge during this period of time. If you need a slot, we have plenty available. Please call Child Care Solutions, 315-446-1220. I want to thank all of our volunteers who have been volunteering. We've been plugging them into many of our continuity of food operations. I want to thank all of our really first responders, our workers in our community who are on the front line every day. They're doing different things every day because we have new gaps and we have new vulnerable that we now have to service every day. So I'm very proud of all of you, and I'm very proud of the way this community is rallying. Again, yesterday we talked about donations. Certainly donations for PPE. Please email us at emweb01@ongov.net or call us at 315-435-2525. These are N95 masks, standard surgical masks, nail salon masks, surgical gowns and gloves, eye protection, and hand sanitizer. Saying that, we will take questions.
The first death in this community is obviously very, very upsetting. What context can you provide to this case that might highlight the people most at risk for this and what this does to your message to this county?
We know that the data proves that nobody's immune to this virus, but certainly the data will show that our vulnerable, our seniors, and folks who have pre-existing conditions or compromised immune systems, if they get this virus, are going to be in for a fight. And we're going to have more of our neighbors that win that fight. But I think this is a sobering reality for everyone, that this is why we're having everybody do what they do right now. And we are making tough decisions, and we're inconveniencing the public because we don't want this to be you or your loved one. And unfortunately, we're here, Andrew. We knew this was going to happen at some point, and here we are.
Can you go a little bit more in depth about if this person had underlying health issues, or if they were in the hospital, and how long they had
the individual was in the hospital out of respect for their family. We're not going to go into many more details about this. I think from the message here is we've lost a neighbor, and they were one of our patients who was in critical condition. And like I said before, we have 8 individuals in the hospital now. 5 are good, 3 are in critical condition. They're fighting, and we need to pray for them.
Have you or Dr. Gupta spoken with this person's family?
I wish I could, Andrew. I don't get that information. I'm not allowed to know that information. So I would love to talk to the 60 different people and let them know we're with you and we got your back. Unfortunately, every time I ask, Dr. Gupta tells me no, and there's a reason for that.
Ryan, New York City hospitals are hitting a crisis point. Have our local hospitals or any part of the healthcare system been asked to supply them with beds or materials, or conversely, have we been asked to take patients?
Tim, we've been building up our plan for central and northern New York to have capacity as this virus becomes more prevalent in our communities. That's what we've done. It would not surprise me at some point if we continue to maintain that capacity and we're ahead of the curve, if we are asked to take patients from outside the community into our hospitals. That would not surprise me. But our job is to plan for the worst for this community. That's what we're doing. We've made every decision that we've made to get to the point where we can really take care of our sick. Right now, we can. And we're planning to expand that capability for our community. If we do everything really well and we start to bend our curve before other parts of the state, I'm sure that the state will look for us to potentially have some sick people here in our infrastructure. I think that's just the reality of the situation.
And that would be a reasonable request if we're in that position.
Look, if we're in a position where we've bent our curve and we have capacity, we are all New Yorkers and we are all Americans. And so that would be reasonable. What would not be reasonable is if we don't have capacity or we have stress capacity and we're being asked to take individuals from outside our community.
The governor has the resources to project the peak, the climax of cases. He said it could begin within 14 days, and the numbers in New York City are staggering. Do you have the ability, based on the data you have, to project our peak, to look into the future as to number of confirmed cases based on pending tests out there, anything like that?
I think we can make assumptions based off of data. And I think when the governor talks, and again, most people who are being, who if they turn on the TV, they're getting 3 briefings a day, one by the federal task force, one by the governor, one by us, giving the perspective for how it's impacting us at the local level and why we're making decisions that we're making. I think the governor, when he does his briefing, is dealing with a crisis south of the Hudson. It is an absolute crisis. So the state perspective and the data they're using is being driven in relation to that crisis for the most part. When we're talking about the impact here at home in Onondaga County and essentially in the surrounding counties, because the robust medical infrastructure that supports all of us is here in our city. So I think right now, with just the timing, and when you look at the testing that's been, majority of the tests will be back. We will still have some outstanding, but we will have an idea on what our curve looks like. And maybe at some point we start to see our curve flatten first and then bend a little bit as people start getting better. But the challenge there is that does not mean we're out of the woods, Andrew. The challenge is how do we continue to keep that going in the right way? And that's why the social distancing for 2-3 weeks gives you time to bend the curve and then stop the new cases. And certainly if we do that well, we will have a good story to tell. But until there is a medical solution towards this virus, our community is always at risk to see that a new curve start.
Does our county have a way of prioritizing test results? Because we've spoken with one other county in upstate New York that is actually having the ability to send their results to different states, say if they want to get a result back in 1 to 2 days. So do we have that capability here? Are we planning on doing that at any point?
So we, the government, don't own a lab, okay? We don't own a hospital, run a hospital. We don't run a nursing home. Some other counties do, okay? But what we can say is we are always looking, the regulations related to testing and what is getting approved by the FDA are changing on a daily basis. We spoke to a company today. We're vetting the company. The company is saying they may be able to turn tests around in hours. Okay, if we vet it, we think it's real, Dr. Gupta's team thinks this is good, we talk to more health professionals, then we buy some tests. Right now, if you go to the triage testing site, or the last 2 days, the turn times have been about 24 hours. That's because the company there is laboratory in Pittsburgh is turning things around very quickly now. The first 3 days are in a different laboratory, and there was a backlog of inundated communities going there at once. So we are always trying to find the private sector partners that will give us the quickest results. But I think it's important, we, the government, do not control the testing turn times. We control the ability to make sure that people that need to get tested, and we're spending a lot of money and time making sure that those resources are here.
And kind of just jumping off that really quick, I know that you've already touched on, you just kind of touched on it again, but in some cases it may take longer than the 3 to 5 day window. I know we've gotten emails from some people in the community saying that they've been waiting 7-8 days for results now. I know that you said on Friday people will probably be getting these results, but for the future, you know, for people who might be waiting that long, what would be your advice to them, and what's kind of going on in that situation?
So I think, all right, so let's just chronologically go over this so that we can do this again so that everybody gets, because we have a better understanding of what happened. We started a triage testing site with our partners at the Syracuse Community Health Center. They are using a company that is under one set of rules Monday through Wednesday. There is a surge in testing Monday through Wednesday under those set of rules. They get sent to a certain lab to be processed. That is taking 3 to 5 business days at the time. Now, due to demand, it's taking a little bit longer. We're talking business days when we say 3 to 5, so everybody understands. If you went Monday at 4 o'clock, you really went on Tuesday. So your 5 business days are Tuesday to Tuesday. So after that, the same company at the same site opens up, the rules change. They can now use a different lab in Pittsburgh. Thursday, Friday, Saturday, Sunday, Monday, I'll go to this lab. This lab is now turning 24 hours, okay? That may not be the case on Wednesday. That lab may be inundated and that may change. This is all fluid and there's changes every day, just like we're briefing you every day. So right now, if you're getting tested, you're getting results back quicker than the people who were Monday, Tuesday, and Wednesday last week who went to the triage testing site. I've communicated with many of them who are emailing. I get their frustration, but the reality is their test is good. Their test doesn't expire. They should be in a quarantine anyways. That's the law. And if you're a non-essential employee at a business, you'd be home anyways. So I need those people to hang on. Our information from the company and the Syracuse Community Health Center is those results are starting to come in and come in rapidly.
We've heard from multiple people, and I know this is not medically accurate, but I think it's important that you tell them this, who think that 5 days have gone by, I have not heard a result, therefore I must not be positive. We know that that is a false sense of security, and I think that's something to reiterate.
Even if 5 days went by and you feel better and your fever's gone and your cough's gone, you're under a quarantine. So don't mess around. And so for those people in that situation, the bad news is you're under a quarantine still and you might be perfectly fine. The good news is we're a community that has made sure that we have the resources to test you, to tell you if you're positive or not. Other communities don't have those resources. So certainly you will only hear a positive result from Dr. Gupta's office or your primary care provider. Others will be getting negative results from the triage site or wherever they got their test.
Just to summarize the testing then, how many total tests have been done? How many are you still waiting for results on?
Yeah, I think, Tim, I think the numbers have gone down each day. We're over 2,000. My estimate would be we got about 2,200, 2,300 out there that have been done. Right now, we got almost 1,400 back. So that number, I think, is going to increase tomorrow in a big way. We've been waiting for this big barrage of tests to come in. But it's difficult because we don't do the tests in my building. Okay, I could give you the exact number every day if we did. The tests are done at a triage site, primary care providers, where we have to go chase down that information, often don't get accurate information, so we're giving an estimate. Crouse, St. Joe's, and Upstate all need to share that data with us to give an accurate picture, and we ask for that data every day. Some days we have an accurate picture, some days their data is a couple days behind.
So if 2,200 round numbers have been done, we're still waiting for about 800 of those. 800,
yeah. So a third, right?
And the expectation people should have if they go to the health center is still 3 to 5 business days?
Yep, even though right now it's trending quicker, 3 to 5 business days is, it's an average, 3 to 5, right? A couple are going to be a little bit more, a couple are now, there's more of them turning around quicker than there are waiting longer than 5 business days. But let's keep that average, let's let that be our expectation. Again, we are out looking at various providers of testing as they're coming into the marketplace. The one came in yesterday, last night. We're talking to them. If it merits and it's real and it can help us, help Dr. Gupta's team do an investigation faster, we're going to invest the money to have that happen.
This is somebody who already has FDA approval?
Yes. Yes.
Brian, yesterday you said that it was 3 straight days of decline in testing.
Yeah.
So did that happen again? Or
Yeah, what we saw yesterday was we saw essentially Sunday and Mondays at the triage site were almost the exact same number. So I would say that that's 4 straight days of decline because Monday was a business day. I haven't gotten an update on what today looks like there, but across the board, we've been hearing from our hospitals that the numbers are going down. Peak we had in the 300s. Now we're about 100 a day. So I think that's a good sign. You could see some regular respiratory illness starting to leave the community, which means that there's less cases you have to rule out. But this helps us get Dr. Gupta's team out and doing what they're doing very, very well. And that's getting people help who are sick, putting people in quarantine that have the potential to be sick, and helping us bend the curve.
Speaking of Dr. Gupta's team, I have a question for the
Dr.
commissioner. You know, a market, a store, possible contamination within those places is, stores ebb and flow. People are in, people are out. A church, I imagine, is a literal congregation of people. How do you decide who is direct contact and who isn't?
So as we talked about yesterday, our investigators really go into very much detail of these cases. So they will interview the case first, get their information, and then they will contact all the other contacts. I mean, I'm just using the contacting contacts. During that time, depending on if we have the organizations like managers or someone, we will go back and check some of those information, because it's important to see what kind of exposure that might have occurred with this case. And that, based on that, then we will guide, we will provide that guidance in terms of contamination or anything. At this point, we do not have anything which we have to say widespread kind of big, you have to clean up. I mean, we always will give that recommendation that you have to clean up and everything with all these EPA approved, all these guidelines are there with this on the CDC webpage, and the things which are approved for the cleaning and all these. So people are doing a great job, but it's not like a big decontamination, a big effort has to be done. At this point, we have not seen that. I'll say touch wood for now.
I have one more.
I'll follow up on that just for clarity, because you've put out two very specific locations, Ashodes and Bethany Baptist.
Right.
And it's hard to understand how out of 60 positive cases, there weren't more of them that were in public places while they were symptomatic.
So that, I mean, we go by the day of the symptoms. That's what we start. That's what the guidance is. And there are people who are going in public places. If they did before, we are not going to count them because, people were not sick at that time. During the time when they get sick, fortunately, most of the people are following these recommendations. Those who aren't, that make us kind of uncomfortable, and that's how we started to find all these places where they might have been working. The other thing which county executive mentioned, that if the organizations are sending their own employees some additional emails without us doing anything, that is up to them. But we did not feel there's anything for public advisory, because we have to say do no harm, so it creates panic if we go with every place. So that's what we have to find, the right information to make sure that when the exposure was and when how many people were around that individual. So if we can contact all of them, then certainly we don't need to do any press release. But in this situation, if these people could not contact, I mean, the Ashodes market, they have no way. I mean, unless everybody paying with the credit card and able to find them, people pay cash, people sometimes come and they didn't buy anything. So all these things we have to calculate in our calculation and say we need to do press release or no. If the Bethany Baptist Church, the same thing, if they could contact all the people who came, then we didn't have to go there. The thing is, if we don't know how many people were, that's how we decide that it's a public information.
If some of these tests are taking 6 or 7 business days to come back,
right,
and that means it's really 8 or 9 days,
right,
are you able to get as good information? Whereas if they come back in 24 hours, people's memories are a bit sharper?
Right, so we want sooner the better. The turnaround time has improved now. The problem which we had, some of the delay in the test, as you can see, some of those, like for the Bethany Baptist Church, is like a 29th. So several days have gone by. We are keeping our fingers crossed that hopefully nobody got sick. These are minimal exposures. We still want to alert the public, although also it raises awareness in the community that social distancing is important. They shouldn't be congregated in bigger places anyways. So if they were there, that kind of pushes back. Even though that's a low risk, if you have underlying problems, heart, lung, chronic lung disease or diabetes or immunocompromised status, all these individuals really need to be very, very, very careful. So that the message, we want to make sure that it's out there with anywhere these individuals might have gone and we are not able to contact them.
Tim, to your point, though, you're 100% correct. We would love a tool and a product that we could have every person who has symptoms in the whole community line up and we give it to them, and we start our investigations and quarantines right then. You are 100% correct. It's not there in the marketplace yet, and if it's there and gets there, we will buy it. I promise you, we will buy it.
In terms of Upstate processing results, we know the problem. We know the government has been supportive. We know Upstate wants it, but nobody's really willing to give a timeline. I mean, what is the hang-up than just a backlog of the appropriate supplies?
Yeah, well, I think you have a supply chain. I think you have to have a partnership with the manufacturer. I think you need governmental approvals, Andrew. And I think it's getting better. I do think it's getting better. I think again, Dr. Gupta alluded to it. Right now we're seeing 24-hour turn times. That is good, and you can make an assumption to Tim's point. Well, what if anybody had 5 days ago had contact with somebody and maybe there's a community spread of that person? Well, they would probably be coming and getting a test. Now in 24 hours we know who they are, we isolate. So now the marketplace is performing better, but certainly the marketplace has gotten stressed at times, and we have to be under the assumption that maybe at some point in the future it will get stressed again. That's why we're continuing to look out for the best, most innovative partnerships that we can work with to make sure that we give Dr. Gupta the best information as quickly as possible to quarantine everybody, and then we flatten the curve and then we kill it. But that is our goal. And testing, there's two problems with testing. One is, do you have the tests? We work very hard in our community, at times in unorthodox ways, to make sure that we have the tests. So we've done good there. Turn times is something that we don't control. We've worked very hard to use partners and then change partners where we needed to so that those turn times get better, and that's kind of where the marketplace is. The marketplace has evolved a little bit.
Ryan, we have spoke to several parents who want an update about schooling. Have you talked to superintendents about whether or not you are gonna extend the school closing? I know some other states have done it through the end of the year.
Yeah.
Have you talked to them, or do you plan on talking with them since your last meeting?
Well, we're going to work with the state. The state right now at least thinks that they're going to have to make the big decision. That's got to be a statewide decision. Certainly, our recommendation, if asked, and we haven't been asked by the state, would be let's look at April 14th, the date we put out originally. That date makes sense. It gives us time to start to see the curve flatten. It gives time, a little bit more time to see where this all goes. And then maybe from there you can make informed decisions from there. But we'll work with the state partners. I think it's important each district really starts to use this time and really starts looking at continuity of learning via technology, though.
Because I know that April 14th isn't in the 8-week CDC guideline of the kind of pushing everything back. So are you just going to wait for guidance from the governor?
Yeah, I think when it comes to state ed, they're the governing body on this. They gave us the ability at one period of time to look at our local situation, being everybody's local situation was different for school closing. So we put out a plan that made sense for really the data related to COVID-19 in our community at the time. Any decisions about closing schools for the year will be made at the state level, and certainly I think the governor will probably assess different regions of the state where they are with COVID-19 in the next week to maybe put an extension on that April 1st deadline.
When you do hear that, can you assure that you'll meet with the superintendents and then put in place something? Because I know several parents are worried about holding a kid back a grade or something like that.
Yeah, we'll communicate with our superintendents, and we'll do whatever's asked of us from the state to help quarterback efforts. We are not in the oversight plan or chain of command related to schools. Because this was an emergency management situation, we then got into that chain of command. But certainly we have nothing to do with curriculum, but we will work with our partners any way we can.
And as a parent yourself, can you kind of talk to parents who, like you said, this is hard for everyone, give them some words of encouragement or anything like that?
Yeah, they're key to this process. And we highlight some bad behavior every once in a while at these reports just so that we remind people of what not to do. But for the most part, our parents are just doing a great job under very stressful conditions. They're worried about their own financial situation. They're worried about their own career paths. They're worried about their kids, explaining this to their kids. And then their kids are going to have good days and bad days. I have 3 kids. Every day when I go home, we get a report, and at least one of them was naughty, okay? A couple days, all 3 were naughty. And they need to work on that. But that's not easy on my wife. And so I want to thank all the parents. And we're going to get through it. This is, at some point, we're going to remember this, and we're going to realize as a society how strong we are and how we can adapt to any real circumstance.
Andrew's never naughty, right?
Yeah, well, Andrews in general can be naughty every once in a while. We're not going to talk about that, Tom. Just out of respect for that family. They lost their loved one today. It was. Tim.
Ryan, you've been planning for some surge sites for extra hospital room. Are those solidified? Do you have the sites locked up?
Yeah, we hope to talk a little bit more about that in detail tomorrow, Tim. We've been working. We have one of the great things about the community. We've had a lot of people volunteer space. Looking at an analysis of all these different spaces has been being done to figure out what it takes to make that space a surge hospital site that would be there for our ICU patients and/or ICU patients in general. And so we're getting there. Commissioner Weirs is working hard on that. He's going to have me something to talk about, I think, soon.
How much capacity are you trying to build?
We're looking at the overall capacity within the whole medical infrastructure, looking at potentially utilizing other surgery centers as well in the community that aren't affiliated with our 3 hospitals. And from there, we're looking at ICU beds and what percentage of confirmed cases tend to be using ICU type treatment. Right now, 6% of our cases tend to be using ICU treatment. So we're using that data to try to build up an infrastructure, and that is requiring purchasing of ventilators so that if we had a true community spread, like other parts of the country, we would then have the necessary equipment to handle what we needed to handle and treat our sick here.
Ryan, I don't know if this is for you or maybe for Dan. The governor is mandating a 50% increase in the number of beds at hospitals statewide, requesting 100%. I know St. Joe's submitted its plan to the state today. Do we know the 3 hospitals about their planning to meet the governor's request?
Yeah, they'll all be compliant with the governor's request. And again, we've been working collaboratively together every day, our various teams, in tackling this. The problem at hand, what's in front of us, making sure that they can treat the challenge in front of us. You heard from Dr. Thomas yesterday. He says green, that means good. That continues to be the case across our 3 hospitals today. And then we continue to build up our capacity for worst case.
So I know that this might be more of a question for Dr. Gupta, but I know that this past weekend when the weather was nice, a lot of people flocked to the parks and outdoor areas. I know that we're preaching practicing social distancing. Everyone needs to be doing that right now. But at some of these parks, it seemed that they were so crowded that at some points people were not keeping social distance. What would be your recommendation for people with that when the weather gets nice again?
Yeah.
I mean, are these parks safe still?
Yeah, so our parks, we encourage people to utilize the parks, but we have shut down bathrooms. Some people are mad at me about that. I'm sorry. We have shut down playgrounds as well. We got great parks. You can go take a run, go to the Loop Lake Trail. Everybody loves it. Take a nice run, take a walk, go to the Parkway, go to Highland Forest, go to Beaver Lake. They're there to utilize, but we still encourage everybody utilizing your 5 to 6 feet of social distancing. And certainly in the event that we believe, if we see a situation like New York City, they just get shut down. Okay, we're not gonna have people hanging out under tents and on a nice sunny day. None of that's happening. So, but right now that's not what's happening in the community, and I think we've done very well. Our advice has been, if you see the parking lot a third full, just come back a little bit later.
Any further update on law enforcement playing a role in any kind of social distancing breaks in the mandate?
Yeah, Andrew, we've gotten some tips that we're concerned about. We've had them patrol. I believe the tips didn't turn out to be very good tips, which we're happy about. That means people weren't behaving poorly.
For Dr. Gupta, I know a lot of community members are making face masks with fabric. How effective are they?
So I think this question Dr. Thomas was trying to answer also. There is, to give an official recommendation, you really have to go through the series of approvals in terms of they should be able to prevent any transmission, right? It's not about dust or anything that you are going to do painting or you are going to do some housework. It's a little bit different. So in terms of when you're talking about typical transmission of infection need to be stopped when somebody's coughing and all, there has to be very set standard, which has to be followed by the guidelines, which is provided by the CDC. All these hospital associations, they all work our infectious disease guideline. Something is better than nothing. Yes, that is true. But certainly we cannot say that work with them if you don't have anything. In wartime, it does happen. If you have nothing, that's what you do. So that's why all these things, emergency management preparation with county executive is working, and Commissioner Ware is trying to work toward trying to get all the resources that we get those proven things, whether it's N95 or whether it's surgical mask, trying to have more production. These are the key things. At this point, I would say that, people should, if you're coughing, if you're hacking, don't go out, stay home. Use your home remedy. That's fine for home. But for outside, you should not be transmitting your infection. And when Tim was asking that how people are, didn't you find any more people? The point is, I think people are being careful. So whenever I see in the line list, which we call as each patient, and then we see that how many contacts, if you have a lot of a person who has gone through many things, it just feels like I'll have a heart attack, right? That's a lot of times, oh my God, no. And then you go through each and every place. So the best thing is if you're sick, stay home. And you can protect yourself, but we cannot recommend those things at this point to use it for, officially use it.
That leads to a good question. Have you seen any positive case, looked at their contacts in the investigation, and seen the benefits of social distancing and hopefully what is limited contact?
Yeah, so we have been very happily surprised in cases that when they felt they are kind of feeling sick, they did not go either to work or they reported and they stayed home. And that is something I said, wow, this is our ideal patient, So people are learning. So all these communications which you put it out and which we continue to talk about, that it really works. And it's engagement of community is the one is going to turn the tide and flatten the curve.
Dr. Gupta, we had a positive test from a worker at the VA hospital yesterday. Have there been any other hospital or nursing homes where there's been a positive test?
So if there's anything, we usually don't disclose anything in typically unless it's threat to the public, and we work with each hospitals if there are, or even doctor's offices, or any places, wherever. It's no different than working with a grocery store or Bethany Baptist Church. The same principle apply to everybody. We look for the course of the onset of illness, how many people, if there was anybody might have been impacted. With the hospital, we work with the infection control offices. They are very rigorous. I have talked to them, actually myself, quite several times after hours or before we start working in here, like 7 o'clock or 10 o'clock. All these things are work in progress. Most of it, I cannot say anything which I have seen which makes our community or hospital uncomfortable. I think we have a really great team working together in identifying individuals who might have been exposed. It's true for anything. I'm not talking about hospitals or anything. I'm talking about in general, any organization.
But in terms of positive tests, you can't say whether any hospital.
So you have to give me context of the VA positive, what you're talking about. I'm not sure. I have not seen that. So I am not talking, are you referring to a patient who was positive there?
Well, we have 60 positive tests. One worked at a hospital. I'm just wondering whether you're seeing any other healthcare workers being affected.
So we do not comment on anything unless it's really impacting the health of the community, because the organizations do work directly through the infection control. They communicate with their employees, those who might have been contacted, and they take them out. So those people will go into the isolation and quarantine. Any healthcare professional who has been working, they have to follow the guidelines which is put forward by the state, and we follow that rigorously.
Okay, one more on that. Have there been any more cases at the airport that you know of?
Again, you're going to go to the same question you're asking. We do not comment on anything unless the organization discloses itself. That's there. That's up to them. But we go to the public when we feel like the general public could have been exposed.
Last question. I did not get a question. I don't know what happened about what's the good news. I was very prepared for this today. Thank you, Spectrum.
Ryan, what's the good news?
The good news, and today is a tough day, but it is Patricia's birthday. and she called and she needed a meal delivered. She wanted a hot meal today. So I got to call Patricia and wish her a happy birthday. We offered to send our team over to sing to her. She said, no thank you. But she did have a special request. She told me she's a little light on toilet paper, so I sent Patricia two rolls out of my stash right over for a birthday present. So Andrew, that's the good news.
Who's Patricia?
I can't tell you who Patricia is. She's one of my constituents. Take care now.